حضرات السادة الكرام, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. I would like to welcome you all here in tonight's public lecture. And before I start and introduce our special guest, I would like to thank King Faisal Center for Research and Islamic Studies for organizing such a wonderful event and bringing you all here and giving us the chance to speak to our special guest in collaboration with the American Embassy. So this is to start off with. Next, I would like to introduce our very, very special guest who flew right from the United States to be here and give us an interesting and stimulating talk. I'll introduce the guest before I talk about the topic he's going to speak to us about. He is the Director of Health Management Program at the American University in Washington, D.C. Prior to joining the American University, he was actually a professor and a program director for the Master's Program in Management of Health Informatics and Analytics at the George Washington University in the United States. Before his academic career, he was a Chief Information Officer at PwC and also the Senior Director of the Healthcare Practice in the Mid-Atlantic. Finally, he's been recognized, Dr. Sam Hana. He's been recognized for his expertise in lots of areas, including program and project management, business continuity, business intelligence, and business governance, also in HIPAA, audit, and risks and governance consulting, and many other more. Please, let's, before we give it away to Dr. Sam Hana, I'd like to tell you that he's today going to talk about how to enable healthcare through tech and innovation. But he's going to focus on the use of artificial intelligence and big data to increase the scale and efficiency of healthcare and to manage long-term challenges, especially those posed by chronic diseases and conditions like diabetes and obesity. Please welcome me in joining Dr. Sam Hana to the stage to tell us about more of this topic.
Thank you so much. Thank you so much, everybody. I like to walk and talk, so I'm just going to wander around as I do this. So but I just want to say to start with, I'm honored to be here. It's very surreal for me to be in this region. I was born in Baghdad, and I left as a little boy and moved to the United States with my family. And that was almost 30 years ago. And I have never been to the region since. All of my family is in the US or Canada. So this is my first time. I was in the UAE last week, and I've been in Riyadh for 2 days. So I love it. It's amazing. And everybody's been very welcoming and warm, and I really appreciate your time here tonight. So I want to spend some time with you tonight to talk about this topic. It's a very important and relevant topic. And it's something that, are you able to hear me in the back? Okay, good. Do I need this? Do I need the microphone? Or can you hear me? Okay, I'll use it. So the topic of healthcare is really important. It's not just something you do when you get sick. It's actually very important to us as a society. And it impacts everything that we do. It impacts policy, it impacts the economy. You know, a sick population is not a healthy population, and therefore it impacts the economy. But a healthy population is a much more productive population, and therefore it improves the economic output of a country. So that's how we tie health. It's a main right for us as individuals, as humans, and it's something that we aspire to obviously use. And technology is something that's going to enable us to improve healthcare for the population and use it better, more efficiently, arriving at lower cost, higher quality, and hopefully improved access. And these are all policy decisions. So I'm a dean at American University in Washington, D.C. I run a healthcare management program there and anything related to healthcare. But I also work with several companies in the field. Some of them are not healthcare companies. They are technology companies. And these industries that are emerging around technology, around healthcare, are going to be the future, the future of health. And there is a trending hashtag, the future of health, that's big in the United States, and I don't know if it's really big here, but it's catching on. So if you are tweeting or on LinkedIn or something like that, use that, and you'll get a lot of information on it. So companies like Google, like Amazon, like Facebook, they're all looking at healthcare as the next frontier for them. And why is that? Because it's about data. Your data, whether it's your genomics data, whether it's your behavior data, whether it's your lifestyle, your sleep habits, all of that. That gives us a better picture of who you are as a patient and as an individual. So the industry, and the healthcare industry, is very unique in that it is really about people, and it's really for people, and it's done by people. We cannot say the same thing for manufacturing or transportation or energy. It's not as personal as healthcare is. So, but this industry is under a constant barrage of challenges from innovations. So innovation is a good thing, but it's really reshaping the status quo, reshaping the makeup of the industry, the operating model that we've come to know for a long time. We have a convergence that's going on between payers and providers and pharma companies, technology companies and biotech companies, right? And as they converge, that changes the way they operate. It changes the way they produce. And that's where the constant innovation comes in. Every day we have new phones with more power. We have new gadgets and tools and technologies. With 5G coming on board in the next few years, that's going to just overwhelm us with the amount of connected devices. And guess what they do? They produce more data, right? So we as healthcare individuals, as healthcare professionals, as people who are looking at how do we actually capture that information, this is a treasure trove, and it's also a very overwhelming concept. So constant innovation is constant for healthcare. The convergence I mentioned earlier is happening and continues to happen, which leads us to more data. And that data, the question becomes, who owns it? Do you, as the patient, own the data? Does Google own the data? Does WhatsApp own the data? Who does? Does the government own the data? These are the questions that are popping up. And every country, every region is dealing with them differently. So it becomes a regulatory and a policy decision. But with the ownership issue comes the accountability issue. So let's say you as the patient own your data. Are you responsible for securing it and protecting it? Or does your healthcare provider have to manage your data and keep it secure from hacks and things like cyber attacks and data leakage? So those are issues that we are grappling with around the world. And medical information, contrary to financial information, is actually very, very prized in the black market. If you lose your credit card or if somebody steals your credit card number, you can issue you a new credit card. But if somebody steals your DNA sequence, we cannot issue you a new one, right? So it's a much more personal attack if something like that happens. So that's the ownership issue is critical, the accountability issue is critical. And to do all of this, we need skilled, continuously trained workforce. And I don't mean just medical professionals. I mean all of us. I mean HR, finance, technology, all kinds of walks of life. We need to continuously learn and educate and upskill our workforce to be able to do this. Because we have the technology in many ways, but we have not trained people on how to deploy it. And that's going to slow the innovation process down. So by the way, I'd love for you to jump in with questions as I'm presenting instead of waiting till the end. So if you think of something, just raise your hand and I'll call on you. So we talked about the convergence of sectors, but what we really should be talking about too is the convergence of technologies. And I'm going to start with genomics. I keep being told to put the mic in front of my mouth. So genomics is going to be critical to the future of medicine because it's all about precision medicine. It's how do we tailor innovation in healthcare to you as a person. So based on who you are, your needs, your genetic makeup, etc. And so that's the first step. And there are major advances happening in this field in terms of DNA sequencing, the amount of data that's coming out of that, the various analysis that can be done through data mining, and other solutions. And just to kind of cement that idea for you, I'm going to give you a real world example, a use case of what's happening. So currently, if somebody's diagnosed with cancer, they go to their oncologist, and the oncologist works with them to find the right chemotherapy, drug that works for them. And that requires sometimes a lot of trial and error. Try a cocktail, see if it works. It doesn't work, wait, try a new one. That is a very long process. It's costly, and it's painful. The lifestyle, the quality of life of that patient suffers in the process. Now imagine if we can sequence that person's DNA and understand it better and be able to tailor a chemotherapy solution that works, that has a high probability of working for that individual. And if we can provide that to them, we can save a lot of time, a lot of pain, and a lot of cost. So that's the first step. Now, we're going to be a little bit futuristic here because this is actually in discussions and in trials. What if we put that chemotherapy inside a smart pill with a sensor? It's an ingestible pill. You swallow it as the patient, and as it goes through your system, as you're swallowing it, it starts releasing that chemotherapy inside your body. And that sensor sends the drug interaction data to an app on your phone, which in turn sends the data to a dashboard at your oncologist's office. And they can watch and see and monitor the release of the drug and your body interaction with it in real time. And should there be an adverse reaction, they could shut it down, decrease it, or increase it right remotely. Okay? That is precision medicine. And those are the kind of use cases and actual scenarios that we are working on. I do a lot of work with the National Cancer Institute of Health in Washington, D.C. area, where we are actually working on designing such clinical trials. So, but all of this requires a lot of data. Requires data about you, the genomics piece, requires data about your habits, your behavior, who you are, your genetic background, your ancestry, your medical record, all of these things to give us a better picture of who you are as a patient. And that's the future of precision medicine. So that's just an example of that. Now, we cannot do that without the other three boxes on the screen. And the first one is the informatics piece, the informatics and the analytics piece. And that piece is understanding that data and being able to analyze it and interrogate it and data mine it. And from there, reach a level of predictive analytics that allows us to understand, will this chemotherapy work for this individual with this type of genome, right? So that's the basic foundational model. Then you take it to the next level, is how can you train machine language, computers, algorithms, to do and to see and do these things repeatedly, and do it better and better every time, right? To learn it. That's what machine learning is. And then once you accomplish that, then you have true artificial intelligence, right? And that's when what we're all aspiring and talking about. So AI has been with us for 40 or 50 years. We've had AI in certain areas. It's really basically at its most basic foundation, really statistics and predictive analytics. So we've had that. There's a major hype going on right now with AI. Everybody's talking about AI, right? Artificial intelligence. But it really is, all it is really adaptive learning, right? You train the computer and the machines to, if you look at something long enough and multiple times, you'll be able to discern what it does, right? And that's what we're doing. We're training machines to be able to understand that if there's this DNA sequence, it means X. And if there's this model of habits, you know, if you're not exercising, if you're not eating well, if you're not sleeping well, and that's those are your habits, the way you live, well then there's more likely that you're going to suffer from maybe diabetes or a heart condition or something like that. So AI is really adaptive learning. It's a way to help us understand better, based on the data, what we have in front of us, and continue to learn it. So just to pick on genomics again, genomics data is doubling at best case scenario. I know this is kind of small. Every 7 months, we're already suffering from an overwhelming amount of data. Imagine if that data is doubling every 7 months. And that's best case scenario. Worst case scenario, it's doubling every 18 months, which is still a lot of time, a lot of information. Meanwhile, all the data that we have on your phones, on your computers, in your electronic medical record, in your genome, all of that is just the 20% of the structured data that we have. The rest of it is completely unstructured, which means it's there, it's a mess, it's in various silos, nobody knows where it is, and it's scattered. And we don't have the ability yet to bring it together, to structure it so we can use it. And that's the majority of the world's data. So imagine if we're able to do that. Imagine if we're able to have the right skill sets, the right people, the right technologies to collate all of this together and make it something that we can tack on to your electronic medical record, to your habits information, so we can create a better picture of you as an individual. And we're struggling in that space for two reasons. One, it's just overwhelming. And two, we don't have the skills. We don't have enough people who are trained in computer science, in analytics, who are skilled to be able to do this. So yes, we have all of these big visions and dreams and things we want to do, but it's very difficult because we don't have the right skills in the workforce. Our medical professionals were not trained in this space. Our technology is moving so fast that technology and coding is changing with new languages all the time. So by the time you learn a language, it could be obsolete in 2 or 3 years, right? So that's what we have to deal with, which requires us to really spend a lot of time skilling and reskilling and upskilling our workforce, especially the workforce that's going to be, whose jobs are going to be impacted by further infusions of technology. So those people are going to have to be retrained. Their jobs will change. And the onus is on us as educators, as policymakers, as regulators, to think about that, because we want them to come along. You know, there's a saying that says, a rising tide lifts all ships. So just because we have new innovation and new technologies that may impact certain sectors, we have to be able to bring everybody else along. And that happens through education. At American University, I can tell you, we are spending a lot of time and energy on launching a lot of skilling programs. We just launched a cybersecurity program. We have launched a leadership program, negotiations. We even launched a lot of soft skills programs, things like interpersonal skills. Empathy is being taught in medical school because doctors are so busy looking at their screens, typing up the information when they're encountering a patient, that it's impacting the patient experience. So we're teaching them empathy in medical school. We're teaching them to understand AI at its highest level, very much an overview. We don't want them to be coders and programmers because they have other things they have to do. But it's important for them to understand, because as we develop new technologies, as we develop new tools, new connected devices, we need that domain expertise. We need that medical professional to be involved in the design of this new tool. Otherwise, we'll end up with tools that do not really address the real needs of the patients or the doctors or the nurses involved. So this is where we are in the space. So I talked a lot about precision medicine, about the individual. But let me ask you, I'm going to do a quick poll here. How many of you, I'm sure all of you have smartphones, I'm sure. Okay, good. Occasionally you might get the flip phone person, occasionally. How many of you track your steps? Okay, good. How many of you track your sleep? Okay, good. How many of you track your diet? Some, maybe? It's kind of hard to do sometimes, So you're already doing this, right? So the gamification, we like it because we get to see a graph of what we've done this week, right? We get to see if we're meeting or beating a certain number we've set. We can see our pulse rate and we can track that. Are we stressed? Are we happy? Are we relaxed? All of these things, right? The gamification of healthcare is real. And we're much more engaged when we are looking at data, at our data. We can see things, we can see if there's a blip, if we've gained weight, lost weight. How many of you have smart scales? Okay? So we want to know. We just want to know. It's a human nature, right? Now imagine if we, let me back up for a second. How many of you here use Twitter? Okay, Facebook, Instagram, WhatsApp. Okay, right? Well, I'm going to pick on Facebook for a second. Facebook owns Instagram, Facebook, and WhatsApp. Okay, so if you're using any of those properties, Facebook probably knows more about you and your mental health than you may know about yourself, right? Based on where you click, how you click, what you like, what you engage with, Facebook through algorithms can tell if you're happy or sad, if you're engaged or not, right? That is the data. Google knows based on your search patterns, based on if you're using Google Maps, they know where you went. If you go into a restaurant, they can tell that you're at the restaurant, right? And they ask you, can you rate the restaurant, right, at the end? They can also tell they can't tell directly what you ate, but they can infer from that data. If you went to a Lebanese restaurant, chances are you had, a Mediterranean or Middle Eastern food. If you went to a Chinese restaurant, chances are you had something with MSG, or something like that, right? So those are things that we don't think about. We're going about our business, living our lives, doing all of this, but there's data, There's cameras, there's sensors, all of that is collecting data. So that data, if we can actually harness it for the sake of the population health is the term, we can do a lot to help prevent diseases. We can do a lot to help educate the population. And that's a major policy decision, right? How can we leverage that information? Not just for the individual, but how can we leverage all of that information from a broader cohort, all of you in this room, and say, okay, everybody in this room has a certain level of education or has a certain level of socioeconomic information. They have a certain background. What can we infer from this group that we can show them something or give them something that will make them healthier or help maybe get ahead of something that may happen? We used in the US, this was a couple of years ago, we were able to use population health data from the various health departments around the country to understand where potential Zika virus cases were going to happen. Zika virus was a mosquito-carried virus that happened in South America and moved up the Caribbean into the Southeast United States. We were able to, based on predictive analytics and population health data, get ahead of it and understand where it might pop up next. So we deployed our resources, our public health resources, ahead of time to try to stop it. And we were successful. Same thing is happening in Africa with Ebola, in certain countries where we are able to get there ahead of time. So it's stuff like that that's really going to be important, and we couldn't do that without the data. So population health is really, really important, but to do that, we have to give the data, we have to share it, and we're always playing in the middle, like a pendulum, between privacy and convenience. If you want absolute privacy, you should just shut all your devices off, okay? Because Siri is listening, Google is listening, right? Right? I mean, you all use it. You use your smart speakers, right? But if you want convenience, if you want things to be done for you, information at your fingertips, you have to be able to give that information away and be able to give the data, allow it to track you. So that's where we are. And different societies have different comfort levels. Different generations have different comfort levels. In my generation, I grew up with computers and technology, then smartphones. I tend to be very liberal about my use of technology. I'm open, use it. I want Google to be as helpful to me as possible, right? My kids, I have a 9 and 11-year-old, they don't even think about any precautions to technology. They just want to be out there. So I'm the one who monitors their behavior, right? But to them, that is not something that they think about, right? So as the future generations rise and get older, our perception of technology and how we use it, what's appropriate, what's not, what we put out in terms of information, what we keep private, that will change too and will shift. And with that shift could come new discoveries as we are able to harness more and more information. So for population health to work, we have to actually give the data and make it accessible. But we also have to protect it and secure it, and prevent any data leakage. And guard privacy if somebody chooses to be private. In healthcare in the US, before you see your doctor, you have to fill out a form. It's a HIPAA form. It's a regulation that we have for healthcare privacy and security. And it tells you basically what they're going to do with your data. And that you have also an ability to ask for an accounting of where your data is being shared, if it's ever shared. So that's really important. But also, at any point, you can call your doctor and say, I revoke my access to my data, which means you cannot use it anywhere. And you have to stop it from being used anywhere else you've plugged it in. It's a very complex and difficult thing to do, but it is how we are protecting the privacy and security of our patients. It's not perfect. It happens that we have data leakages, we have hacks that happen that have compromised millions of records. It happens. But at its most basic form, we have that ability to say, you know what, I changed my mind. I don't want my data shared anymore. Yes, sir.
Other than the patient and the doctor, who would the data be accessed to?
It could be accessed by research institutions. The data could be de-identified.
With consent?
If you consent to it, it can be released. But if you do not consent,
What about next of kin?
it depends on if there is a directive that allows them to have access. So a spouse, maybe, or a father, son, brother, possible. But you can also revoke that, if you wanted to. So, which actually brings up a very good point. Research. A lot of data that we have is protected. So if we are allowing it to be used, we have to ensure that it's de-identified. So when you submit your data for a genomics test to find out, if you half Saudi or half Iraqi or whatever, right? That data is sitting on somebody's server. And you've asked or told them by agreeing that you would allow them to use that data for research purposes. So these companies like 23andMe and others, Ancestry.com and others, they can basically de-identify your data, package it, and sell it to a pharma company. And that's exactly what they do. So pharma companies they love this data because they can actually simulate research based on this, which will hopefully actually speed up drug discovery and solutions to some of our chronic conditions. So it's a good thing. But what happens if that data is leaked or stolen or somehow gotten re-identified, tracked back, right? That's the danger of this. And it's clunky. The system is very clunky right now. It's not designed. It's very complex. So the chances of that happening, it can happen. So we have to be thoughtful about what we're doing, and everybody has to be educated and aware that just because you signed something, there is a risk. And are you willing to live with that risk? And that's also a major policy decision. What's the regulatory body doing to control that, to educate about that, to train medical professionals, researchers, how to use this, to have a system of checks and balances around this information. So that's really important. The second piece, which actually we were going into, is the technology and research piece. We are actually seeing a lot more universities in the US, a lot more research think tanks opening up and are willing to share their data. It's de-identified, but they're willing to share it, to collaborate with other institutions in an effort to speed up research. And with technologies, with data science, with languages like Python and R, we're able to simulate research much faster than actually doing it through clinical trials. And hopefully, I'm very hopeful because I spent a lot of time in that space, that we will be able to come up with some real results much faster than if we had spent 10, 20 years following up a clinical trial on something that may or may not work. So that's really important going forward. And the third thing is knowledge. I spoke about the skilling of the workforce. That's really important. We cannot do this without a skilled, knowledgeable workforce who is able not just to do, but to understand why they're doing what they're doing. So critical thinking is really important, and that's something we're doing a lot more of in schools. I can only speak for the United States, but it's funny because, again, I'm going to talk about my kids. In elementary school, they're teaching them about critical thinking and project-based learning and things like that. And at American University, we're pushing our students to do more in that space. In fact, and this is a very interesting statistic, more than 50% of my students in my healthcare management program are doctors and nurses. For two reasons. One, they want to learn how to be better managers, better business people. And two, a lot of them are thinking about leaving the medical profession to move into administration because they're tired and burnt out from all of the stress and the overwhelming amount of demands on their time and behavior. So it's a very interesting time in the medical profession because of this new technology. So if we were to ever have a physician shortage, for example, because of these trends, we hope that we're able to step up our technology innovations to alleviate some of that and extend care further. Things like virtual health, telehealth, are things that come to mind when you think about extensions of healthcare to reach maybe an underserved population, whether it's rural or somebody who maybe is unable to go to the doctor. We've also had instances where healthcare systems have partnered with companies like Uber to send an Uber to the patient's home to bring them to their appointment because they cannot afford to pay for a taxi. to come to the hospital, to come for their checkup if they have a chronic condition. Because if they can't afford the taxi, guess what? They're going to miss their appointment. And that's not good for them. It's also not good for the system, because that's lost time, lost money, right? So these things are kind of the fabric of all of these things is blended together. So now you have healthcare, working with car companies and delivery. You have Amazon, who bought PillPack, so now you can actually order your prescription and have it delivered directly from Amazon in the US. You have Google entering the healthcare field in a big way with research. That's their focus, is on data. And all of these other companies, Google just bought Fitbit, if you've been watching the news, right? So wearables, connected devices, there's going to be more and more of that with 5G. So just because we are focusing on the patient, we also should be focusing on population health, because the patient is one piece of that. Any questions? Okay, so we talked about the three circles behind me and how they're all connected together. We talked about the skills. I'd love to get an understanding from you. How many of you here are medical professionals? Okay. How many of you are in business? Okay. How many of you are in government? Okay. Great. I'd love to get a sense from you, and please, I'm not going to pick on anybody, so you raise your hand and speak. But are these the same things that you're seeing here in the kingdom? Are you seeing the same issues, the same challenges that we're seeing in the United States? Or is there something different?
In what sense?
In terms of the convergence of all of these technologies, in terms of the lack of skills.
So I'm at a university hospital, and we were one of the first institutes to establish an electronic health record system.
Okay.
And I spent a couple of years updating the system to encompass all of, because patients have been following since I believe the 70s, and so they've been slowly but surely updating the files. But I've seen it's just anecdotal evidence, but like an increase in the quality and quantity of research that we've been turning out.
Good.
So that would be my
This is much better, I think.
observation. Oh, that's it. That's all. That's it.
Okay. No, that's great. What system do you use? Cerner?
I'm not sure what it's called. Like I just know it as e-secretary.
Okay.
Yeah.
Okay.
So,
Yes.
so I would say from the electronic health records point of view, we have a good, our hospital use Cerner, and it's a good system. It fragments the data very well. It's easy to collect the data. It's easy to tell the computer what data you want and from what type of collection you want. The issue is, from my perspective, is the people that are inputting the data. It's very difficult to, there you go. I think there's a lack of proper knowledge of how to input the data. So it's easy to take the numbers, if it's the temperature or a lab result, but when I wanted to get specific data, that's why we standardize patient description. So this is the only issue I see. If I want to get something that is descriptive, I'm most probably not going to find it.
Sure. Well, again, I think that's a great example, and it highlights that we're still looking at education and awareness as the first step. We need to teach people how to enter the data, what to look for, where to put it, right? Garbage in, garbage out, right? So we want to get the right garbage in, right? So, or hopefully not garbage, but you know what I mean. Healthcare is very difficult to manage. It's a system that's been set in its ways for a very long time, and new technologies are really changing and pushing it. So it's really not just about training, but it's also about change management. How do you manage all of these cultural changes, events, perceptions, realities, fears? People are afraid that their job may change, it might be eliminated, or They may have to move or change locations and things like that. That is true. And when you're fearful, when you're afraid, when you're uncomfortable, you're going to resist. So with all of this, we have to also implement a system that's going to be able to allow people to increase awareness, increase education, help them, handhold them through the transition. It's a transformation. And that's really important because a lot of implementations fail because the culture impedes the strategy. You can strategize all day long, but if you're not able to win the hearts and minds of the people that are working and doing this every day, they're going to resist, and your strategy is worthless. So we have to think as we transform, how do we bring everybody along? How do we think about them and how their piece of the puzzle, and how can we make them comfortable? Bring them along through education, through maybe reskilling and retraining. If their job is truly going to be changing, allow them, help them get to that next job that they need, right? Because technology is going to change the way we do things. It's going to change the processes we follow. It's going to change different certain job descriptions are going to change. We're not going to have as many manual processes. We're going to have a lot more, upskilling people who are doing things with technology. And people are really afraid of AI. It's a myth that AI is going to replace doctors, right? It's a myth. We've had technology innovations for many, many decades. And yes, there are some jobs that are affected at the lower end, the least skilled end. But technology has only increased the number of jobs in the world because more and more can be done with technology. And AI is no different, right? So it's not about this robot that's going to read x-rays better and images better than the radiologist. It's not. It's about this AI that's going to read that information alongside the radiologist, allowing the radiologist to focus on high-value items and let the machine focus on the generic everyday items, low-value items. So, and that's a great way to extend care. It frees up the doctor to see more patients, more critical patients. It reduces cost, and it improves quality. There was a study that was done in the US it was a study to kind of compare, and this was not meant to say which is better, but it was really a comparison between a machine learning algorithm that was reading 1,000 x-rays and 12 experienced radiologists reading the same 1,000 x-rays. The machine learning algorithm was able to be 25% more accurate in its diagnosis than the experienced radiologist. This is not a knock on the radiologist, but that's the kind of power the machine can have if we train it appropriately. And that's what we're talking about with AI, okay? So, I don't want you to leave this room tonight thinking, oh my God, that's not the case. We are going to be okay. We just have to get everybody to work with it. We have to be comfortable with it. Just like we are comfortable with using technology, our laptops, our tablets, your phones, right? This will be no different. It'll provide more connectivity. But, we talk about all of this, and we have to think about why we're doing what we're doing. It's really about you and I when we are patients. But hospitals, for example, are so overwhelmed by their infrastructure, by their complexity, the healthcare system itself, all of it. There are competing priorities and agendas. There are lots of initiatives that are competing for resources, money, time, effort, all of that. So while that's happening, our patient is also changing. Our patient is more empowered by technology than ever before. If you cough or if you get sick, the first thing you're going to do is check your symptoms, right? You show up to your doctor already knowing what your diagnosis is because you're so knowledgeable, right? You're an expert. You Google it. You go to WebMD or some other tool that are out there. So we're doing that already. We want data all the time. We want it when we want it, how we want it, and whenever we want it, wherever we want it. It's at our fingertips all the time. So that's who we are as patients today. And that really adds another level of complexity to our system. Because if I'm a healthcare provider, my reaction would be, well, I can just give my patient everything. So I'm going to put up this portal, and I'm going to have all kinds of knowledge on this portal for my patient. Well, what we've learned is that patients don't even use them. They only want to use them when they want to use them. You cannot force them to go to this portal. You know, their go-to is Google, right? So we have that. We also have patients who are more connected to social media and their friends and families than ever before. So if I had a bad experience at my dentist, I'm going to tell my friends on Facebook about it, right? Or I might tweet about it. Or I might go to rate my doctor and give them a 1-star, right? That's the reality of care for the future. You know, I'll give you an example. I found my dentist on Yelp. Yelp. Do you use Yelp here?
We don't have that.
Don't have. It's a rating system for restaurants and services in the U.S. I didn't have one, so I thought, you know, what better place than to go and see what people are saying about various dentists in my area, in my city where I live. So I just typed dentist in the search bar. I got all these dentists by order of distance from my house. And some were 4 stars and 5 stars and 3 stars. And I just went through and I looked at the reviews, what people said about them, and I chose a dentist. And I went to see her, and it was great, right? That's how I found my dentist. That is how people are going to be finding healthcare in the future, you know, based on various metrics that you're looking for. Distance, cost, you know, access, all of that. So that's who our patient is. So this patient wants us to cater to them. They're consumers. We're all consumers of healthcare when we need it. And because we're consumers, all of these companies are getting into the space. You know, I mentioned Facebook and Amazon and Google and others. So they're working directly with hospitals. They're working directly with pharma companies. They're working directly with payers. There's a lot of vertical integration that's happening in data in the healthcare space, at least in the US, whereby, you know, data companies are right there with research universities. Google has a lot of collaborations with universities conducting research at a national level, right? Amazon is getting into healthcare. They're creating their own healthcare company, you know, and many others. And that's just the tip of the iceberg. Then you have all of these medical device companies out there that are creating new devices and connected devices that are going to be prevalent all around us, especially when we have 5G. We have a bigger pipeline of data and bandwidth to enable that. So if you think we're connected now, just wait. You know, it's going to be not just your thermostat, it's going to be your doorbell, your smart lights, cameras everywhere, smart refrigerators, all of that stuff, which can give us even more data about who we are as individuals and as patients. So to do all of this, to manage it all, you know, I mentioned how doctors are going back to school and potentially wanting to leave the profession. We have to engage the medical professionals. We have to get them embedded into the system and engage and cater to them as well. Because a happy clinician allows for a better, you know, care and a better service and a better experience for that patient too. So we have to not forget about them. We also have to not forget about the employees in the healthcare system. A lot of times, the mistake is made where we focus so much, we think healthcare is just about doctors and nurses. So much of healthcare is not clinical. It's 80% of healthcare are all of the other jobs in administration, in HR, in finance, in technology, in operations, in security, in janitorial services. Those are all, they all work in the healthcare ecosystem. So we have to make them happy, keep them engaged, maybe leverage technologies to help their jobs too. And that's where AI can be very effective, you know, in terms of talent management, resource management, scheduling, things like that. Finance, billing, revenue cycle. You know, those are real case studies that can be done today with artificial intelligence. So we don't have to wait on a connected device for that. We have the data. And then once you do these top two first, then you can accomplish a much better patient engagement and patient experience. So that's where we are. That's what we're trying to do. And it's very difficult. And I don't have to tell you, the US healthcare system is not, we don't have it figured out, okay? We're trying to figure it out. But we're always, as long as we keep the patient at the center, at least we know, at least as long as we are able to know what they want, when they want it, and how they want it, and then be able to deliver it to them, they will be more engaged and more satisfied, and hopefully arriving at a higher quality, more access, and lower cost. And that's what we all are striving for. So I do want to give you a couple of frameworks before we end tonight. And if you think about the patient journey, I'm going to stand over here so you can see it. You know, when I get sick, the first thing I'm going to do is I'm going to go to Google, right? I'm going to look it up, going to research it, investigate what do I have. Do I have the flu or is it just a cold, right? That's the first step, discover. And then I'm going to engage with the healthcare system. I'm going to reach out and schedule my appointment. I'm going to go to physically be at the office, at the doctor's office. And I'm going to hopefully be treated, right? In the treatment section. I will get there, I will arrive, I will have the patient encounter, and I will hopefully get treated, cured, get a prescription, whatever. And then I would exit and transition back to normal life, you know, back to my job, back to my home. I will get the bill, pay it, whatever, right? The area where we have the most friction, where we can have the most impact on the patient experience is in the engage. I'm not saying we don't have impact in the other areas. We have impact in all of this. But the engagement has the most friction because that's really where things can go wrong, where there is misdiagnosis. There is a long wait time in the office that may make me upset, right? And I might give them a 1-star for that, right? It's all of these things. So if we can harness the power of technology to improve any of these quadrants or all of them, we can really drive healthcare in a big way and make a huge impact. If we are able to allow the patient to schedule their appointment online on their phone and receive them on time, that's huge. If we're able to triage them correctly, right away, fast, that's huge savings. If we're able to transact all of their data and information and billing without errors, without wrong bills and having to call it back and fix things and replace things, that's huge. That saves so much time and energy and funds. So all of this together is how we can impact the patient experience. Because patients want to stay connected, but they want to be connected on their own terms. They don't want to continue to check your website, but they will check your website when they need something, right? Or check your app or whatever. So this is critical. The other thing that I want to share with you is this. This is really how artificial intelligence works, but it's really a good way to project manage any new innovation that you have. Whether it's a new product, a new tool, a new process that you're rolling out, and even education. You know, and machine learning is about taking a lot of information and analyzing it. But analyze it to do what? You can break it down by demographics, male, female. It could be by age groups. It could be by location. It could be by socioeconomic data, it could be by medical data, whatever that segmentation is important. But you cannot get segmentation before analyzing what you already have. So analyze and segment. Once you have that segmentation done, then you can design a solution for that segment that you're targeting. Let's say I'm looking for women over 50 years old who have diabetes. That's my segment. What can I design? If I'm looking to actually design a product or a solution for them, I would look for that specific demographics and look to target them based on the research in that space, for that age group, for that segment of the population. Once I design a solution, I would target them through awareness, training programs, knowledge management, all of that, pushing that information out. Then I would execute. I would get them to use that new sensor. You know, now you don't have to prick your finger to check your blood sugar anymore. You can just wear a sensor on your finger that does that. That's artificial intelligence. Okay? It's not some robot that can do that. It could be simple things.
That is real?
That is real. Yes.
That's just example.
No, that's real. The sensor on your finger, you can actually use the sensor to measure your blood sugar continuously. You don't have to do it. You don't have to prick yourself 3 times a day anymore. Yeah. So it's things like that. We have technologies that already exist, but some of them are not approved to be used. Like in the US, we have to get FDA approval for a lot of these technologies. So if it's not FDA approved, it's not on the market. So we have technologies. We know they work, but they just haven't gone through the process because it's a very cumbersome process. So you execute, you actually deploy it and use it. But you don't just do that. You actually have to monitor it and optimize it. So there's a continuous feedback loop that has to happen. So you're continuously iterating and reinventing and creating something better so you can repeat and do this more and more and come up with new generations of technologies. You know, technology companies do this all the time. Software companies send out new releases and patches all the time. Apple comes up with new earpods all the time, right? New ones. Because they're monitoring your behavior. They're seeing what works and what doesn't work, and they improve it, right? That's the same thing for medical devices. Everything is going to be connected, and we have to continue to monitor how we're using it. And we have to put the patient at the center, because the patient will tell us, based on their data, based on their use, what works and what doesn't work. We don't have to guess anymore. Because if the patient wants to use this technology, they've consented to giving that data back. And you do now. When you use Twitter, when you use Instagram, you're consenting to them using your information. So what's different? Any questions?